Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about a condition that affects millions of people around the world. It's called asthma. It's more than just a little wheezing or an occasional shortness of breath. For many, it's a daily challenge and can even become life-threatening if not properly managed. To help us understand asthma from all angles, about all ages, what it is, how it's treated, and the exciting new developments in this field, we're joined today by someone I admire, Dr. Bryn Henderson, a board-certified physician, an attorney, and a pioneer in regenerative medicine. Dr. Henderson, I welcome you, and it's always a pleasure to have you on Doctor. So let's start at the very beginning. What exactly is asthma?
Well, asthma is a chronic condition that affects your lungs and airways. Think of your airways as tubes that carry air in and out of your lungs. And in people with asthma, these tubes often become swollen and overly sensitive when exposed to certain triggers like dust, cold air, or exercise. The airways overreact. They tighten, swell, and produce a lot of mucus. This combination makes breathing difficult and causes that familiar wheezing or chest tightness.
So, what exactly happens inside the lungs when someone is having an asthma attack?
That's where it gets really interesting and important. There are three hallmark things that happen during an asthma episode, and all of them are part of how the body tries but fails to protect itself. First, when an irritant enters the lungs, whether it's dust, smoke, or cold air, the body responds by creating mucus to trap the irritant. But in asthma, the lungs produce too much mucus, and it starts to pool in the alveoli, which are the tiny little air sacs responsible for exchanging oxygen. As the mucus builds up, it becomes heavy and sticky, and this makes your chest feel tight. The alveoli start to swell. This swelling puts pressure on the airway and triggers a cough. Your body's way of trying to get rid of the mucus, since the cough is the watchdog of the airway, the cough is going to bring up that mucus. And one of the most relieving things someone with asthma can do. But if the mucus does not come out, it can clog the airways even more. Third, the muscles around the airway go into spasm, trying to push air out. This causes the wheezing sound many of us associate with asthma. It's that high, tight, high-pitched noise when the air struggles to pass through the narrow tubes. So asthma is really a triple threat: mucus, swelling, and spasm. And that's why it can be so uncomfortable and dangerous when it flares.
Well, I've had a lot of asthmatic patients before of all ages, and this really paints a clear picture. What are some of the triggers that set off this kind of reaction?
Triggers vary from person to person, but common ones include allergens like dust, pollen, pet dander, and mold. Other exercise, and even emotional stress. Knowing your personal trigger is key to managing asthma effectively.
Is asthma something you're born with, or can it develop later in life?
Well, that's an interesting question. And in fact, it's a great question. Asthma can develop at any age. Many people get it as children, and adults can develop it too, especially when they have allergies, if they're exposed to certain chemicals at work or have a family history. My family history, my grandpa died of asthma, my mom died of asthma, and I can tell you that's very, very common in our family. So these respiratory infections in childhood sort of set the stage for asthma that continues a lifetime.
So how do the physicians actually diagnose asthma?
Well, we start by looking at the patient's symptoms and listening to their history. But if there's recurring wheezing or coughing, especially at night or with activity, then we test with a breathing test that is called spirometry. That measures how much air is coming in and how much air is going out. Sometimes we also use a peak flow meter or challenge test to confirm the diagnosis. Allergy testing can be helpful too, especially when we suspect the trigger is dust or pollen.
Okay, so before we go into treatment, I would like to know, how do pediatricians or others taking care of children, say 2, 3, 4 years old, that can't actually do a spirometer test,
Yeah, that's fair.
how do they diagnose that you have childhood asthma?
They diagnose because of the patterns of that illness and its response to various treatments. So you have an advantage because you have the ability to know the pattern.
Okay, so let's now go on to treatment and what that looks like for someone who's been diagnosed with asthma.
Treatment usually involves two categories: rescue medications like albuterol, which open up the airways quickly during an asthma attack, or controller medications are like inhaled corticosteroids, which reduce long-term inflammation in the lungs. Depending upon the severity, we might also use long-acting bronchodilators, which open up the airways. These medications reduce allergic inflammation. An exciting development, the SMART, S-M-A-R-T inhaler, and that stands for a single maintenance and reliever therapy. So instead of using two inhalers, you use one inhaler daily. The SMART method uses a single combination inhaler, usually a low-dose steroid plus formoterol, as both are daily controllers and a quick relief option in one. This simplifies treatment and has been shown to reduce severe flare-ups.
So is this an inhaler or a pill?
This is an inhaler, and it's especially for people who struggle to remember the multiple inhalers they need.
Yeah.
It's an all-in-one.
Yeah.
It's user-friendly and has already proved that we can improve outcomes that can be controlled. So we teach patients a mnemonic, asthma care, as the approach. It's a comprehensive but simple roadmap, asthma care.
All right, so the A stands for?
Avoid triggers, stay away from smoke, dust, pollens, and pets, and any cold air that worsen your symptoms.
S.
S is stick to the treatment plan. Take your controller inhaler every day, even if you feel good.
T.
Is to track your symptoms. Please use a diary or app to notice patterns and catch early warning signs.
H.
H is have your inhaler ready. Keep your rescue handy, and you know how to use it properly.
M.
Monitor with a peak flow. This helps you detect worsening before you feel it.
A.
A is to act fast during an attack. Don't wait around. Follow your asthma action plan immediately.
C.
Check in with your doctor with regular visits so your plan still fits your needs.
A.
Is for allergy management. Consider allergy testing or medication alterations that help prevent triggers for your asthma.
R.
Is relax and breathe. Breathing techniques and stress reduction help reduce airway tightness.
E.
E is doing what you do now. You're educating yourself. Know your meds, know your triggers, and when to seek help, do it early. That's your best defense.
That is a great mnemonic. I want to talk about a couple of things that I've learned over the years from doctor to doctor. I once had a doctor who wrote a book on asthma, and he said in our interview that he believed that patients who had asthma breathe faster, like they hyperventilate. So a normal person would be breathing 20 breaths per minute, and hyperventilators are in the 30 range. He found that asthma patients were in the 28 range. Do you concur?
Well, your reserve is going to be less if you're damaged, so that you're going to need to have more respirations.
Oh, so your body uses the defense mechanism.
Yes.
Okay. He also suggested that if you don't have your inhaler on you and you know you're going into an attack, he said grab a bag, put it over your nose and mouth, and start breathing into it so you're breathing carbon dioxide to slow down that hyper.
Slows down the hyper.
Yeah. And that was interesting. My other thing I want to bring up before we get into your case study is when I was a traveling doctor for 10 years and I was up near the Yosemite area and I had 8 tribes, 8 different Native American tribes in my clinic. And every single person, whether they were an adult or a child, came in and I would have to put them on a breathing treatment. I mean, maybe it wasn't every, but it seemed like every patient. Are there certain groups of people, we're talking about Native Americans in the Yosemite area, that had asthma in a larger percentage than, say, another percentage population of America?
Doesn't surprise me at all. The genetic predisposition to asthma is in other parts of the world as well.
I was stunned. I said, how could these people, why do they all have this weakness? All right, so let's go on to a case study so we can illustrate to our audience something that you've done in your practice.
Yeah, we had a 45-year-old school teacher who came in with the classic asthma symptoms: nighttime wheezing, breathlessness during activity, and sensitivity to dust. And we started him on a rescue inhaler and an added steroid inhaler and eventually long-acting bronchodilator. He also tested positive for dust, mite, allergies. So we added environmental control steps. And today he's doing very well, exercising more, sleeping better, and rarely needing any rescue inhaler.
Well, that is a hopeful study for sure. So now let's go to new and alternative treatments that people are just hearing about, and you're working with them in your office, but maybe their doctor doesn't even know about them yet.
We use regenerative therapies. Anytime you need to make new cells, you can use regenerative cell therapy and you make new cells. You can also use vesicles, which are the exosomes. That coupled with the peptides, which helps repair the airway lining. For people with severe recurrent or treatment-resistant asthma, they not only offer hope, they offer solutions.
This sounds really interesting. We're entering a new era for asthma care. And actually, I'm happy about it because, like I said, I've seen it in every single age group.
Exactly. And the future asthma management is already here. It's personalized, it's less invasive, and it's far more effective. And with some of these new tools, we're not just managing asthma, we're reversing some of the damage in the lungs.
Well, that makes me happy. I love it that we can reverse disease and pathology. Thank you, Dr. Henderson. And to our viewers, whether you're living with asthma or caring for someone who is, remember, knowledge, action, consistency are your best allies. Talk to your doctor, follow your plan, and seek out these innovative medicine treatments. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.